Berlin, Germany, 2007. Timothy Ray Brown is dying, but not from AIDS. Brown has acute myeloid leukemia, a blood cancer. He needs a bone marrow transplant, but Timothy also has HIV. His German doctor, Gero Hutter, has a radical idea. What if we could cure both diseases at once? What happened next would make medical history and prove something many thought impossible. HIV can be cured. To understand Timothy Ray Brown's cure, we need to understand a genetic quirk. HIV docks onto a protein called CCR5 to enter cells. About 1% of people of Northern European descent have a mutation called CCR5 delta 32, making them naturally resistant to HIV. Dr. Hutter searched for a donor who matched Timothy's tissue type and had the CCR5 mutation. First, chemotherapy and radiation destroyed Timothy's immune system. Then the donor's stem cells were infused. Those stem cells began producing new blood cells that were resistant to HIV. Timothy stopped his antiretroviral medications. His viral load remained undetectable, not because of drugs, but because there was no virus. Doctors searched everywhere for HIV and found nothing. Timothy Ray Brown was cured. In 2019, the London patient, Adam Castillejo, became the second person cured of HIV using a similar procedure. The cures didn't stop there. By 2024, at least 7 to 9 people had been cured of HIV through stem cell transplantation. But stem cell transplants are dangerous, life-threatening procedures. You can't ethically perform them on someone who only has HIV. But what if some people's immune systems can naturally control HIV? They're called elite controllers. Elite controllers keep their viral loads undetectable without medication. They don't develop AIDS. Scientists found that elite controllers have exceptionally powerful killer T cells that destroy HIV-infected cells. Meet Laureen Willenberg, diagnosed in 1992. She's an elite controller who's never taken antiretrovirals. This has sparked research into therapeutic vaccines to train the immune system to control the virus like elite controllers do. While scientists hunted for cures, someone had to fund them. In 1985, Elizabeth Taylor co-founded AMFAR, the American Foundation for AIDS Research. AMFAR pioneered celebrity-driven fundraising. Elizabeth Taylor hosted star-studded galas and testified before Congress. By 2024, AMFAR had invested over $600 million in HIV/AIDS research, funding more than 3,500 research teams. But here's the paradox. As treatment improved, urgency for a cure diminished. Should we be satisfied with lifelong treatment? The answer may determine whether future generations live with HIV or live free from it. Join us for the final episode of our series. Visit unbedsidemanners.com for more stories.